Do this with me right now. Hold up your hand. Take your other hand and place two fingers, your index and your middle, right here on the inside of your wrist, just below the base of your thumb. Press gently until you feel it. That little tap, tap, tap under the skin. Got it? Now count. Just 5 seconds. Count the taps. Done? Good. Hold on to that number, because what you just felt, the speed of it, the rhythm of it, whether it was steady or whether something felt off, that tells a story. And most people over 60 have never been taught how to read it. If your rhythm felt uneven, if it skipped or paused or did something you weren't expecting, keep your fingers right where they are. We need to talk about that. Before I go any further, I read every comment on this channel, every single one. If something in this video worries you, or if you've been dealing with something nobody's explained to you properly, write it in the comments. I respond, and when I see the same concern showing up again and again, I don't ignore it. I make a whole video about it. So talk to me. That's what this channel is for. Now, here's what I'm going to walk you through today. 5 things your pulse is telling you about your heart right now. Not theories, not things you need a lab for. Things you can feel with your own fingers, sitting right where you are. And I need you to stay with me until the end, because there's one thing, one habit, that almost every senior does the moment they wake up in the morning. And it forces your heart to work twice as hard before the day even starts. We'll get to that. But first, let's understand what you're actually feeling when you press on that wrist. The artery you're touching right now is called the radial artery. It sits just under the skin. It's one of the most accessible arteries on your entire body. Nurses check it, paramedics check it, doctors in emergency rooms. The very first thing they reach for is your wrist. Not because it's convenient, because it's honest. That little pulse tells them more in 3 seconds than most blood tests tell them in 3 days. And you have access to the same artery right now for free. But here's what changes as you get older. After 60, your arteries start to stiffen, gradually. You don't feel it happening. There's no pain. There's no moment where it clicks. It's just, over years, the walls of your blood vessels lose some of their elasticity. The medical term is arteriosclerosis. But what it means, in plain terms, is that your pulse starts to change character. It might get a little faster, a little harder, a little less regular. And most people never notice because nobody ever told them to pay attention. So that's what we're doing right now, paying attention. 5 signs, one by one. Keep your fingers on your wrist, and I'll tell you exactly what you're feeling and what it means. But before we start, I need to say this clearly. What I'm showing you today is not a diagnosis. It's an observation. If you notice something that doesn't feel right, here's what I want you to do. Write it down. Use the exact words I give you, and bring that piece of paper to your next doctor's appointment. One clear sentence from you saves your doctor 20 minutes of guessing. That's how you become your own best advocate. And if right now, right this second, you're feeling chest pain, sudden dizziness, or you can't catch your breath, stop this video. Call for help. That comes first, always. All right, let's go. Sign number 1, the speed. This one's simple. Count your beats for 15 seconds. Got it? Multiply by 4. That's your resting heart rate. A normal range is 60 to 100, but normal and ideal aren't the same thing. For most people over 60, the sweet spot is somewhere between 60 and 80 beats per minute. That's where your heart is working efficiently. Now, if your number is consistently up around 90 or above, that's not an emergency, but it is a signal. Write this down exactly like this. My resting heart rate is consistently, and then your number. Bring that sentence to your doctor now. This next one. This is the reason I made this entire video. Sign number 2, the rhythm. Close your eyes for a moment. Just feel it. Don't count this time. Just listen to the pattern. Is it steady? Tick, 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 tick. Even spacing, like a clock. Or does it do something else? Does it skip one? Does it throw in a pause where there shouldn't be one? Does it feel like it stutters, then catches up? Because if it does, you're not imagining it. And you're not being dramatic. An irregular pulse is the single most common way that people detect atrial fibrillation at home. AFib. You've probably heard the word, but here's what most people don't realize about it. AFib affects 1 in 10 people over the age of 65. 1 in 10. That's not rare. That's your bridge group. That's your church pew. And a huge number of those people have no idea they have it. Sign number 3, the strength. This one's about pressure. How hard is your pulse pushing back against your fingers? If you can barely feel it, if it's faint, thready, like you have to press hard just to catch it, that can point toward low blood pressure. Or it could mean a valve in your heart isn't closing as tightly as it used to. On the other hand, if your pulse feels strong, almost aggressively strong, like it's pushing your fingers away, that can mean the opposite, high blood pressure, or your heart compensating for something it shouldn't have to. Neither extreme is normal resting behavior. Both are worth mentioning. Write this: my pulse feels unusually weak, or my pulse feels unusually strong. Your doctor won't need more than that to know what test comes next. Now, do something most people have never once thought to do. Sign number 4, the symmetry. Switch hands, same spot, 2 fingers on the other wrist. Feel the beat. Now, compare. Right wrist, left wrist. Back and forth if you need to. Do they feel the same? Same strength? Same rhythm? Or is one side noticeably weaker? Because here's something doctors do routinely that they almost never teach patients to do themselves. If one pulse is clearly weaker than the other, that can indicate a partial blockage in the artery on that side. Write this: my pulse feels weaker on my left side, or right, whichever it is. Your doctor will know exactly what to order. Sign number 5. This last one, I need you to actually move. The recovery test. Stand up from wherever you're sitting. If you need to hold on to something, hold on. Take your time. Stand for a moment. Then sit back down. Now wait 60 seconds. Then check your pulse. A healthy cardiovascular system bounces back fast. Your heart rate goes up when you stand. It should. Gravity shifts your blood. Your heart responds. That's normal. But within about a minute of sitting back down, a healthy heart returns to where it was before. If you're sitting there after 2 minutes and your pulse is still noticeably faster than your resting number, that's telling you something. It doesn't mean something is broken today, but it means your heart is working harder than it needs to just to recover from the smallest effort. Standing up and sitting down. Over months, tracking this number, even casually, gives you and your doctor a real window into how your cardiovascular fitness is changing. Not a guess, a measurement. Write this. My pulse stays elevated for however many minutes after standing. Simple, objective, useful. Now, the morning habit I promised you. Think about how you wake up, the alarm goes off, or you just open your eyes. And what do most people do? They sit straight up, swing their legs over the side, stand, walk to the bathroom, all within, 10 seconds? Here's what's happening inside your body during those 10 seconds. You just spent 7 or 8 hours lying flat. Gravity wasn't pulling your blood downward, it was distributed evenly, pooled in your core, your lower body. Your heart was cruising, low gear, resting pace. And then, in one motion, you go vertical, and your heart has to suddenly push all that pooled blood upward, against gravity, to your brain, right now. No warm-up. When you were 30, your arteries were elastic enough to handle that. They squeezed. They adapted. Blood moved. After 60, those arteries are stiffer. The adjustment takes longer. And in that gap, that 5 to 10 second window where your body hasn't caught up yet, that's when you feel dizzy. That's when you grab the nightstand. That's when falls happen. First thing in the morning, more often than people think. The medical term is orthostatic hypotension, but the fix doesn't require medicine. When you wake up tomorrow, don't sit straight up. Roll to your side first. Then push yourself to sitting. Stay on the edge of the bed. 30 seconds. Just sit there. Let your blood pressure adjust. Let your heart catch up. Then stand. 30 seconds. That's it. And that small, quiet pause before your day even starts could be the single most important thing you do for your heart every morning for the rest of your life. It costs nothing, and nobody ever tells you. Now you know. If anything in this video applied to you, please don't sit on it. Write it down. Bring it in. You now have the words to use. Your doctor won't need more than that. And if this helped you understand something new about your own body, send it to someone, a spouse, a sibling, a friend you check in on. That's how we look out for each other. I read every comment. Tell me what you felt. Tell me what concerned you. I'll see you in the next one.